One sector that is bearing the brunt amidst the country's worsening economic climate is maternal health care. Rising inflation, limited access to essential drugs, and a healthcare system struggling with resource shortages have all compounded the deteriorating state of maternal health in the country. Mrs. Kate Ekejuba is a mother navigating the challenges of postnatal care at the height of the country's inflation. Like many expectant and new mothers in the country, Mrs. Kate had to make difficult choices between attending critical prenatal appointments in the face of frightening daily expenses.
The addition of transportation, going to hospital now, is a whole lot. Okay, even I can't even go to hospital now often the way I'm supposed to go for checkup for postnatal because of increase of transportation. So I go once in a while. Accessing the milk now is very high. In my first issue, then naan, we bought the last we bought is about 2,000. But now can I tell you that naan is 8,500, 9,000, depending on where you're buying it from. So it's very high now.
The rising cost of healthcare is not just affecting mothers, it is also taking a toll on relatives who support them. Cost of food has significantly increased. A cup of rice now costs 350 naira, and a cup of beans is now 400 naira. With prices this high, how can a mother eat well and adequately feed her baby? Even the price of water has risen. Nigeria's inflation rate in August 2024 reached 24.8%, according to the National Bureau of Statistics. The impact of inflation in maternal health care is undeniable, but it's not just the mothers feeling the strain. Healthcare professionals are also sounding the alarm.
Malnutrition and poor health outcome is another factor of economic barrier to health or to maternal and child. A pregnant woman that feels that she don't have enough money to buy food, adequate nutrition to eat for herself and her unborn child, she decided to make do of what she has. It leads to malnutrition to the pregnant woman and even to the unborn child. And most cases you see the pregnancy don't develop the way it ought to. Malnutrition can lead to stunted growth. It can lead to abortion. It can lead to miscarriage. Malnutrition can lead to anemia in pregnancy and also neonatal anemia.
President Bola Tinubu in June this year signed an executive order aimed at boosting local production of medical supplies by removing tariffs and VAT. However, clinical pharmacist Dr. Sunday Olatunde highlights that these measures have not sufficiently addressed the issue of affordability for the average Nigerian.
It has tendency to work in the long run, but not for the immediate situation. If you heard me right, I mentioned pharmaceutical raw material, meaning that is targeted at producing medicine locally in order to ensure medicine security. But that is not extended yet to the medicines that are produced that we are importing. It then means that in the codification of this executive order by the Attorney General of the Federation, we will expect that this executive order is extended to produced medicine, which are now being imported, because Before industries and companies will be able to take advantage of this executive order and start production, like I said, it's targeted at producing drugs in and the local way, that's in Nigeria, and not relying so much on imported medicine. However, if companies will take advantage of that, it's going to take some few months to 1 to 2 years to put facilities in place to be able to produce, even while taking advantage of the executive order.
According to the World Health Organization, Nigeria accounts for nearly 20% of global maternal deaths, with a maternal mortality rate of 512 deaths per 100,000 live births in 2023. Lack of accessible healthcare remains one of the leading drivers of this alarming statistic. Health expert Chukwu Godfrey warns that a shortage of qualified specialists exacerbated by economic constraints is forcing more women into unsafe conditions, often leading to fatal outcomes.
You don't need basic healthcare skills in meeting some key healthcare needs of the people. You need certified experts. That is why you have specialists. Well, because even the government cannot afford to train, the government has stopped training healthcare workers. Government cannot train nurses, cannot train midwives. They have to fend for themselves, and those who cannot be able to do that. Instead of them venturing into nursing, they go into trading and all sorts of things. So you see, it really affects. So when you don't have the right people providing care for you, when you need a skilled birth attendant and then it's not there, you just go to anywhere you can access help, and that also complicates the issue and is causing an astronomical increase in the cases of maternal mortality, and even infant morbidity rate is increasing.
Midwife Miss Ibe Olivia points to chronic infections and complications as leading causes of maternal deaths.
Most people will tend to look at the way the cost. Most people cannot even afford the paying bills at hospitals, especially the private sectors. So after considering these factors, they opt to delivering at home. They will just look for a trusted traditional birth attendant to help them with the delivery. And sometimes it's successful, but most times it's not successful. And these people tend to come down with either birth asphyxia. If it's the baby, the mother might come out with postpartum hemorrhage and other sorts of complications.
Negligence, combined with skyrocketing costs, paints a bleak future for maternal health care in the country. Although Mrs. Kate Ekejuba and her family remain hopeful, the burden on mothers like her is immense.
Basically, it wasn't easy. Even with my husband, my business is not that strong. He's even the one struggling, trying to. It was not easy for him. It's just by the grace of God.
As Nigeria struggles to recover economically, mothers and their newborns appear to be paying the price. With each passing day, the demand for affordable healthcare becomes more urgent, yet solutions seem increasingly out of reach.
Economic barriers has created significant challenges in Nigeria's health sector, increasing the risks of preventable deaths during childbirth. Without urgent intervention, including government policies, funding, and quality healthcare, this may likely worsen. Maternal healthcare is a priority as it directly impacts our families and the well-being of the nation. Naomi Oleribe, Adbn News.